April 22nd, 2016, I was diagnosed with brain and spinal cancer. I was in the hospital for 14 days, and it is safe to say that those 14 days were the worst 2 weeks of my life. Sorry. My doctor sentenced me to 4 chemotherapy rounds and 30 radiation grays over the course of 4 months. I became severely depressed. I did not want to keep living. I did not want to fight for my life. The only reason I survived to speak to you all today is because of the community that rallied around me, the incredible nurses and doctors that treated me, and attending a camp called Roundup of Range. I was diagnosed at the end of my 8th grade school year. I played soccer and ran cross country. I was obsessive with how my hair looked and had to maintain the perfect reputation I seemingly had. One phone call changed my life. It was the first Friday of my spring break when the phone rang. Hello. Hello, is this Rowan's mom? This is she. I'm calling with Rowan's MRI results, and I'm afraid I have some bad news. I was diagnosed with brain and spinal cancer. From that moment on, my life was defined by a bald head and the nurses that made it my reality. I remember right after I had Mediport installed, a little plastic piece that acts as an IV, a nurse kept stabbing the freshly surgical area right in my chest. Even after I started screaming for help, she resisted the notion that she was doing any wrong. On the other hand, I remember a nurse that urged me to go for a walk. The last thing I wanted to do was get up and go on a walk, but she made me. And I must say that going on a walk truly helped me. It made me recognize that I was not alone, and that I was strong even in the midst of my trauma. Healthcare systems need good nurses, that know what's best for you even when you do not. Nurses must learn to stop stabbing in the dark. In addition, I formed amazingly close relationships with my doctors and doctors' assistants, as well as child life specialists. There were times that I would only want to talk to a child life worker named Rachel. Rachel helped me through every needle injection and every blood draw. She played checkers with me and let me win even when I was delusional from all the drugs. She helped me beat the record in the team room's basketball machine with only one hand because my other hand had an IV. Rachel was a huge reason that I fought to survive. She cared for me in a way very few did. On top of that, I have developed life bonds with my primary oncologist and her nurse's assistant, Erin. Having this type of medical support is almost like a second family, and I know that they will always be there for me. My friends and family also came to my side when I needed them most. Many fundraisers were organized in my honor. People I did not know showed up to my hospital room and gave me gifts of encouragement. I was amazed at how my adversity brought people together. If it were not for the immense compassion I had felt through those around me, I would have had no reason to keep trying to survive. Between my 3rd and 4th chemotherapy sessions, I attended a camp called Roundup of Range. I would be completely lying to you if I did not say I was utterly terrified. I was scared that I would be judged for my bald head and seen as only a cancer patient. To my surprise, I was treated with nothing but smiles, and during camp I met kids who had situations much worse than mine. I was awed at how they could still see the light in the dark and dance in the rain, even when their realities were filled with terror. By the end of camp, I developed a newfound gratitude for the little things and discovered a newfound passion to fight for my life. All of the experience above enlightened me with why I needed to stay alive. I realized that I had to share my story. I have to tell people how compassion and non-judgmental eyes kept me breathing through the hardest times of my life. It was the good nurses, hospital best friends like Rachel, community support systems, and accepting groups like Roundup of Ranch that have brought me here today. The most important part of healthcare in my eyes is getting the patient to accept themselves for who they are. If I were to have not become okay with who I am, I would not be here. To keep fighting, I needed to be loved even when I did not love myself. I needed to be seen as a companion instead of a burden. I needed acceptance just as much, or if not more, than the drugs. I live on today to share with all of you the reasons I survived and to stress the importance of having compassionate, non-judgmental support systems throughout all of your battles. Thank you.